This week, we hit over 100 million known COVID cases around the world. And with over 2 million deaths, and now this variant that's more contagious, it doesn't exactly look like we're turning the corner on this thing. I asked the Glorious Geeks if you've been trying to stay safer, and 85% of you said yes. So it's not just me wearing 3 masks to the supermarket. The White House just banned travel by non-US citizens from 27 European countries, the UK, and South Africa. And countries around the world have locked down or have upped the COVID restrictions. In the Netherlands, for example, the Dutch government imposed a 9 p.m. curfew to help stop the spread of the virus, which resulted in violent riots across the country. Like, what's the big deal? So you stay in and watch Bridgerton for a few nights. Who would want to do that? It's like soft porn. We're now in a race against the clock to get people vaccinated, but poor countries around the world are struggling to get the vaccine. So the White House announced it would help raise funds or donate some of our vaccines to poorer countries, which has raised some eyebrows here because people are asking why we should donate vaccines before we finished vaccinating our own. It's a sticky issue because on one hand, you want your government to take care of its people first. And on the other, ensuring equitable access to the vaccine is not just a question of compassion, but also of economics. Helping poor nations benefits the economies of wealthier ones. But I'm not going to pretend to be a disease expert, so I brought on my friend and super geek, RP Eddy, to discuss. RP drafted the very first pandemic response plan for the White House under President Clinton, and he was the co-architect of one of the most successful health initiatives in history, called the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which saved 24 million lives. He co-authored the award-winning and best-selling book, Warnings, Finding Cassandras to Stop Catastrophes, which, no surprise, is featured prominently on my boyfriend Dr. Fauci's desk. He also co-hosts a podcast with the Nantucket Project called RP Daily. Things are pretty bad with this pandemic, and I know that Ergo, your company, advises some of the world's largest firms and investors in some of the world's leading countries, including our own. And so I wanted to reach out to you. I know that you all have built this epidemiological curve. Can you tell us how you built it?
Yeah, so we have a group of really young, really brilliant analysts who have zero background in epidemiology or vaccinology or anything. And we said, let's go build a curve so we can help our clients understand the future of the disease. And what that means is every month or so, we make a future prediction about where the disease will go in America and in 14 other countries. And look, lots of people have these. You can go to GitHub and you can find software on how to build them. And so we kind of stood on the shoulders of a bunch of folks who had done that. And we added our own secret sauce. So we added cell phone mobility data. So how much are people moving around versus last year? We added social media sentiment analysis using AI, like how do people feel? What are they talking about? What's the chatter? We built a social unrest meter back in March before the George Floyd killing and protests about how much unrest there was. All these things and other things we think feed into our ability to predict the disease. And as you can see on this chart here, our predictions have been, I think, the most accurate I've seen in the world. Way more accurate than the White House models, more accurate than what the CDC has been ingesting, more accurate than the University of Washington models, which have been very popular, by a huge degree. So it gives us a really strong view of where the disease is going.
It blows my mind to see this chart because of not just how accurate it is, but how scary things are becoming. So if things don't change, where are we headed?
You recall the idea of the ghost of Christmas future, right? Here's the future. It's horrendous. And if you don't change your ways, you're going to land there, right? We've seen all the different movies describing the ghost of Christmas future. The ghost of Christmas future for the United States right now is instead of 500,000 or 600,000 dead in May or June, which is a horrendous number, we could have 1 million people in this country dead by 5/1, by May 1st, if we don't change things dramatically. Now, that is a huge number. It's the ghost of Christmas future. And I'm not saying we're going to get there. In fact, I'm saying to you, we'd have to work ignorantly to get there. We'd have to continue very bad policies to get there. We'd have to have a really bad rollout of the vaccine to get there. And this UK variant would have to take force in a way that unfortunately it's going to. So if we don't increase mask wearing, if we don't increase social distancing, if we don't shut down bars and gyms and some other super spreader spots, if we continue with the very poor vaccine rollout that Trump left us, and if the UK variant B117 takes hold the way it is going to, then we're going to be in a much darker period than we are now. Literally more than twice as many people will have died at that point than now. We don't need to get there, but I still think we're looking at 500,000 dead in a few months total. So it's going to be grim. We tell our clients, We're basically halfway through this. And one thing we should talk about quickly is the Stockdale paradox.
So tell me about that. Go ahead. Yeah, please.
So look, have you noticed with you, Hagar, I've noticed at our house, even though I talk about this all the time, this has been a hard couple of weeks, right? So not just the January 6th siege in the Capitol, and not just the stress of the election, and not just all that. This is, didn't we kind of read a bunch of news about vaccines are here and it's supposed to be light in the tunnel? And isn't it coming? It's not coming for a while, right? So it's a number of months, many months, until we're going to have enough vaccination that we don't have to worry about tons of incremental death. The Stockdale paradox says the people who are most rah-rah will be out of this by Christmas, we'll be out of this by spring, we're almost done, it's almost there. They're the ones who die, the psychic death first. Admiral James Stockdale in the Hanoi Hilton, the Vietnamese prisoner of war camp where he was tortured for I think 8 or 9 years. Later, interviewed by Jim Collins, the great business writer, he said in an offhand comment, "Hey, Admiral, who survived, who died in those camps?" He goes, "I'll tell you exactly who died. It was the rah-rah person who was so sure we'd be out in a month or 2 months. They died. They were too enthusiastic. They didn't realize that it was a long slog. Who survived? Those of us," and this is where we have to be, Hagar, "those of us who knew we'd get out of this, knew that our destiny in many instances is in our control, at least in the health dynamic, but it's not going to be immediate. We're going to have to slug it out and keep knowing there's work ahead. And at some point we will be on the other side of this mountain, but we have to keep the journey up the hill going." That's the Stockdale paradox. And I forgot that. And so I've been kind of like, whoa, what's going on? Isn't it time to, get back to life? It's also, of course, getting the deepest, darkest parts of winter. So
I feel like you're talking to me personally, because I have been that person who's like, by summer, we're traveling, it will be fine. The kids will be fine. So
we might be, but summer's a long way off. And, the middle of January always feels a little crummy if you live in the Northeast, right? So we have that on top of the fact that we are still in the middle of a pandemic, right? If you want, maybe we're at the last, the last third, but we're right in the thick of it, and it's going to get worse before it gets better.
Oh, that's
so remember
bad news. That's such bad news. Okay, well, so I have one last question for you, which is, do you think that the partisanship in Washington is what has been holding back an effective response to this pandemic in the United States?
Great. Thank you for asking. First of all, I'm sort of done thinking that criticism of ineptitude, incompetence, sedition, and gaslighting is partisan, right? I don't think we've had a partisan debate in this country in the last at least 2 years. I think we've had a debate about facts or not, about lying to people or not, about being competent in your job or not. And I can have this whole conversation and not mention those 5 toxic letters, right? So we had, when the Biden administration showed up to go see where the vaccine was, what the vaccine rollout plans were, and to get underway on it, they found empty offices, no briefings, and apparently literally no plan, nothing doing. So they are building the 747 in mid-flight. Was that partisanship, or was that irresponsibility, incompetence, dereliction of duty, narcissism? I mean, that's what it was. And on top of a nice, potpourri of unconstitutional behavior. So it's not partisanship anymore. And folks who say, "Hey, RP, I saw you with Hagar and you were being partisan." I didn't say the name of the former president. I didn't talk about a political party. I'm talking about you and I both are in government, Hagar, and it's like any other organization. Do you show up? Do you have a plan? Do you have competent people? Are you executing every day with the best interests of your client, in this instance, the country in mind, or not? And if you don't, you get shitty outcomes. If you do, then America's got so much energy behind you. The citizenry's got so much ability to push you forward. Then you can do all right. It's not partisan. It's just a reality. So let's take a deep breath, myself included. It's, sunny days ahead. It's just a competent government. It's not that it's one part or the other. It's folks who want to do the best thing for the rest of us, not just for themselves, without the ruthless, relentless, denialist propaganda that we've been gaslighted with for the last, at least the last 6 months.
You are so right. I hope that you're right, RP. I'm looking forward to some brighter days and to some better governance. And I think you're right. It's not about partisanship at the end of the day. All right. Well, thanks for coming on and for explaining all this. This has been so valuable and so insightful and so mind-blowingly terrifying.
Well, and look, the control's in our hands. There's some people where it's not. Frontline workers are at risk. Medical professionals are at risk. But for the rest of us, get a good quality, at least 3-layered mask, increase your social distancing. This new variant is 30 to 70% more transmissible, and it's more deadly. Things that kept you safe before may not keep you safe now. So you might think, hey, I know what to do. I know what I'm doing. I'm not following CDC exactly. I'm not really I'm wearing a bandana sometimes, and I'm chatting with people that aren't in my bubble. If that worked for you before, it very well may not work now. So get back to the basics about what you need to do, realize the consequence of getting it wrong, and it's in our control to stay safe right now, except for those few people I mentioned in the beginning who really have to be out there serving us. For the rest of us, it's not going to seep in through air vents. It's not coming across the computer screen. You can protect yourself right now, and you can protect all of us by reducing the transmission.
You're so right. Well, I hope that message gets across the country. All right. Well, thanks, RP. Thanks for joining me.
Thanks, Cigar.